We're delighted to now be offering combined adult ADHD and autism assessments at the Edinburgh Practice. We've brought it in for two main reasons. One is based on the feedback of our clients, and the second is that research tells us that autism and ADHD commonly coexist. So all of our combined assessments are multidisciplinary. And how does the assessment go? What does it look like? So we have 3 assessment appointments. The first is an hour and a half, and that's with one of our consultant psychiatrists, where initially you can talk about what has brought you along for the assessment. They'll go through a clinical interview discussing your mental health history from childhood and as an adult, your physical health history, your relationship history, your family history. They'll start to look at autism with you and discuss that. You're welcome to bring someone along with you to the appointment if that would make you feel more comfortable, but also because it's really helpful to have that second perspective there during the initial appointment. And then the second appointment will be with one of our clinical psychologists, and that involves using a diagnostic interview for ADHD, which is in line with our best practice guidelines. And that's looking at ADHD symptoms from childhood and adulthood. And in that appointment, we're really looking to get some good examples from your childhood, perhaps of impulsivity or times when it's been difficult to focus. And the reason we look at childhood and adulthood is because ADHD, it's really important that we're seeing the presence of those symptoms in childhood early on, and we want to see them across different settings. And that's what makes it a trait, but we're looking at different settings like school or education like university, the workplace, social interactions, how you present in the room. And there's a second part of that appointment that's called the developmental history. And during that part of the appointment, we're gathering information from even back to when you were a baby. And then the third appointment is with speech and language therapy or clinical psychology, and that's working through something that's called the ADOS. And that's a semi-structured assessment tool to gather information on autism. That involves having conversations, and there's also some practical tasks based around books and different objects that our clinician will lead you through. And it's something that there's no right or wrong way to answer the questions. Our clinician is just interested in how you approach the different tasks or different conversations in the setting. And one really important thing to say is that throughout all of our appointments and throughout all of your time in the practice, we really want you to feel as comfortable as you possibly can while you're here. And our assessments and the environment has been curated with neurodiversity in mind. So that involves things like thinking about how the lighting is, thinking about the temperature, letting you know that you can get up in the room and walk around and answer questions if that's how you'd prefer to do it. We're most comfortable when you're most comfortable, and that's something we really want you to know when you're coming along to the practice. And then what our team do is we meet and we discuss all of the information that we've gathered throughout the appointments from you and from someone who knows you well, and we look at all of the questionnaire data. And then we look at the diagnostic criteria for autism and for ADHD, and then we'll offer you a feedback appointment where you can meet with the consultant psychiatrist who you met with at the start, and they will share with you whether you meet criteria for autism or ADHD, and they will explain how we have come to that decision as a team, and they'll also make recommendations that are really tailored to you as an individual. Because that is one of the most important things, that you leave that appointment knowing I suppose the answer to the question that you came for, but also knowing what's going to be helpful for me in my life moving forward. And that will all be written up in a really detailed report that will be sent to you and to your GP to ensure that your GP is also kept up to date with your care. And it doesn't stop with diagnosis. So If following on from the assessment, you would like to receive support for autism and or ADHD at the practice, we have a team who specialise in working with adults with ADHD and autism.